Hey guys, it's Dr. Joseph Bogart here from Parkland, Florida. I'm here to give you some quick tips and some guidelines on what to do for acute as well as chronic injuries. All the time I hear people say, do I use ice? Do I use heat? Do I use compression? Do I do elevation? What should I do? It really depends on the individual circumstance, but I'm going to give you some general guidelines first. The general guidelines are this. If it's a new or acute injury, you want to do ice first, usually for the first 48 to 72 hours. After that, they recommend introducing heat. I personally like introducing ice and heat, a combination of the two, where you would do about 10 minutes of heat, 10 minutes of nothing, 10 minutes of ice. That allows new circulation and new material to get in and start healing the tissue, as well as the cold will pull out the old waste products, as well as some of the damaged material out, etc., and allow for a faster healing. For some people who don't like ice or don't have access to ice, there are products out on the market. One that we use in our office, this is Cryoderm. It's an excellent product. It has homeopathic things like arnica, boswellia, ilex, MSM. It's awesome. I recommend it to all my patients who need it. I use it myself, as well as a lot of people that I work with and or train. We call it like liquid magic stuff. It's just great stuff. Also, for some of you who are already aware, there's a product called Tramiel, which is a cream, also oral or injectable, homeopathic, that allows and speeds up healing. And something that I use, they're very expensive, but I think they truly are an amazing product. And here's an open packet of what are called whey patches. These are these weird black tarry substance that I don't know if you can see this. You put this on like a bandage, and what happens is it speeds up healing and microcirculation, and allows things to heal like sprains, strains, tears, even fractures in a relatively short period of time. You do have to get these from a physician, I believe. We sell them in our office. For more chronic injuries, when we start introducing heat, usually about 10 minutes at a time, this is a product called Zeal, which is excellent. It's good for arthritic issues, old scar tissue issues. And you can also use the Cryoderm that we used earlier, and this product, which are whitey patches, which do the same thing as the fast patches, and they're by the same company. But these whey patches, the whitey patches, help deal with scar tissue, arthritic changes, etc., even disc issues and things of that nature. So if you have an acute injury, I also recommend predominantly compression. And compression is now the new recommendation, more than just ice. But you can also elevate it, so you have rest, ice, compression, and elevation, which is the old RICE recommendation for an acute injury. And then once it becomes subacute and it's been there for a few days, then you can do ice and heat. And if it's really chronic and been there for a long period of time, you can do just heat if you like. But personally, I like ice and heat in the combination. So those are the tips for the day. If you have any questions and you'd like to give us a call, you can call us at 954-340-7545, or check us out on the web at www.phandwc.com. And again, I'm Dr. Joseph Bogart, and I hope that helped and gave you some great information. Bye-bye.